Welcome to the Advancing Surgical Care podcast, brought to you by ASCA, the Ambulatory Surgery Center Association. ASCA represents the interests of outpatient surgery centers of every specialty and provides advocacy and resources to assist them in providing safe, high-quality, cost-effective patient care. As with all of ASCA's communications, please check to make sure you are listening to or viewing our most up-to-date podcasts and announcements.
Hello and welcome to the Advancing Surgical Care podcast. I'm Bill Prentice, the CEO of the Ambulatory Surgery Center Association, or ASCA. My guest, who will join me in a moment, is David Thawley, the CEO of HST Pathways, a leading provider of software solutions for both the clinical and operational needs of surgery centers. HST Pathways is also a valued ASCA affiliate member, and we thank them for their continued support and collaboration. I've asked David to talk with me today about HST's recent release of a 2024 State of the Industry report for the ASC community. The report spans 50-plus chapters of industry research, firsthand experiences, and includes best practices, key process steps, KPIs, and benchmarking data for every step of the patient journey and every recurring administrative duty. And while we won't have time to cover all their findings and recommendations today, I encourage everyone listening to download your own copy of the report from the resource section of their company website at hstpathways.com. With that introduction, David, welcome to the podcast.
Thank you for having me, Bill. Good to be here.
So, David, before we jump into some of the findings, could you take a couple of minutes to tell us about your methodology and the extent of the data you gathered for the report?
I'm happy to, Bill. And I guess before I get started, I just wanted to provide a shout out to two HSC Pathways team members, Will Evans and Eric Palmer, who led these efforts for HST. And really the intention of this report is to take a wealth of data that we luckily have at HST and help share some insights to ultimately shine lights in areas that ASCs can potentially improve their performance and optimization. And just as a reference point, currently today, HST touches roughly 11% of the surgical population in the United States. We're in over 1,700 ASCs, and all the way from the point of scheduling through post-service revenue cycle management, we've got a wealth of data that ultimately led to our ability to create some of this industry report and the benchmarking work. But specifically, what we used in the industry report came from 590 surgery centers across 47 states and north of 3 million cases that were managed out of HST Pathways. And these are data points that we had explicit permission from our clients to use their de-identified data in order to help create this report. And the report itself is 50 chapters, more than 130 KPIs, and over 35 charts with a lot of year-over-year trends to help give some insights as to how the ASC industry is evolving.
It is expansive, and I think it's just a tremendous resource and something that I think, everyone in the ASC community will find some really interesting information about. As head of the report, you highlight 5 ASC-related trends that emerged from your data in 2024. Can you briefly touch on each of those?
Sure. So the first major trend that we've noticed is cardiology, and this is a specialty that is on the rise in the ASC space. And the cardiology trends in surgery centers between 2023 and 2024 ultimately reveal shifts that the average duration of operating time needed for these procedures decreased by an impressive 28%. And I share that because of one of the things that obviously makes the ASC environment very attractive vis-a-vis the hospital environment is the efficiency which physicians can perform their procedures. And cardio being a new specialty in the ASC space, we're just seeing these impressive efficiency gains as cardio increases penetration in the ASC market. And so you combine this improving efficiency with high net revenue per case, which we see as $4,600 on average per case. And those two combined mean that we're seeing very impressive improvements in overall revenue per minute of operating time in the ASC setting, where in 2024, it was just north of $132 per minute, which was about a 30% year-over-year increase vis-a-vis 2023. And so this being one of the newest specialties in the ASC space, higher acuity, higher dollar procedures, and great level of efficiency for these physicians, we just think that this is going to be a specialty that's going to do great things in the ASC space.
David, that's fascinating information. And as you may know, cardiology is very much on our mind on the advocacy front. And one of the things that we're really looking to do with Medicare is obviously convince CMS that we can be safely performing many more of these procedures on Medicare beneficiaries as well.
Great. Second major insight that we have and share in the report is that orthopedics achieved almost a 5% growth in net revenue per case. And Bill, as you're aware, orthopedics continues to generate some of the highest net revenue per case within the ASC environment. And in 2024, this increased to $6,400 per case versus $6,100 per case in 2023. And we really see this growth reflecting the demand for orthopedic procedures and potentially higher reimbursement rates of a greater mix of complex cases. And this consistent rise in revenue underscores how important orthopedics is from a surgical specialty perspective in the ASC market. And so yet again, this is another specialty alongside cardio that we expect to continue to see a high level of growth.
Yeah, and I think important for our listeners, particularly outside of the ASC community, to understand is, we're still providing tremendous efficiencies and savings by having those procedures being performed in the surgery center versus the hospital. So even though revenue might be going up, still when a case goes to the surgery center, the patient, the payer is saving an enormous amount of money almost all the time.
Absolutely. The third key insight, and this one surprises me in the data, was a really impressive improvement in claim denial rates across ASCs. And it dropped from first submission denials of 8% to 4% in the ASC setting. And to us, this trend really reflects more effective revenue cycle management, possibly due to better documentation and improved coding practices, and also the use of more technology and AI to help ensure clean submission of claims. And obviously, reducing denial rates by half in this case allows surgery centers to capture more revenue and reduce the administrative burden of resubmitting claims. So I think another key positive indicator of ASCs understanding how to operate, in this case, as a business more effectively, submit claims more effectively, and drive more positive differentiation via revenue cycle.
That's a powerful data point. And to your point, I guess the more effort that's put in on the front end of that claims process is paying off on the back end, and that's what your data show.
Absolutely. On our insight number 4, it was that ASCs with 2 ORs saw the highest level of year-over-year growth. And I'm sure all of our listeners know in this case that we'll see ASCs from 1 to 20 operating rooms, but we typically see ASCs grow in the number of operating rooms that they have over time. And as they have more utilization of the existing operating rooms, or they may bring in additional specialties into the ASC, that's where you see a lot of that same ASC growth over time. But in the case of 2 OR facilities, they saw the highest level of revenue growth at 22% year over year. And so we think that this surge may indicate that smaller ASCs are becoming more efficient or better positioned to adapt to market demands. And in contrast, larger ASCs with 15 plus ORs experienced an 8% decline. So there seems to be this level of sweet spot that I think at the end of the day comes down to how are you balancing your operating room utilization in a way that can drive the greatest case volume, but efficiency of that case volume with a high level of utilization.
Again, just an amazingly interesting data point that I think that ASCs around the country are going to really look to and think hard about.
Agreed. So the last insight, and I'll try to be quite brief with this, is that partial payments increased while total payments decreased. And between 2023 and 2024, ASCs experienced a shift in payment patterns, and partial payments increased from 41.2% to 56.2%, indicating some patients are paying in installments and payers are reimbursing incomplete amounts. Meanwhile, total payments decreased from 25.8% to 17%, suggesting that fewer patients are settling their bills in full. And this trend overall emphasizes the need for improved payment plans and financial assistance options and strategies to boost collections are really important facets for our ASC partners and facilities to get their hands around.
That's also very fascinating. And for the listener, I mean, we asked David to limit himself to 5 trends. You probably could have done 500 based upon just the immense amount of data that you have in your system and in this report. So thank you for those highlights. I want to know, your report also covers best practices for revenue cycle management and a lot of detailed billing and payment information like you were just discussing. Can you take a moment and focus on the effects we're seeing from the increased demands for prior authorization?
Sure. So I'm going to go into a few different areas here, but I guess as you think about some of the revenue cycle benchmarks broadly, pre-authorization is such a critical component when required in order to optimize the revenue cycle reimbursement rates and denial minimization. But we saw that in 2024, only 24% of cases completed pre-authorization when it was required, meaning that 3/4 of the time, even though we know a pre-authorization is required, the facility was not submitting or completing that pre-authorization. That is up slightly from 2023, when only 21% of cases completed pre-authorization when it was required. Obviously, the impact of that are delays in patient care, scheduling issues, claims denials, and they also impact speed to revenue as well as patient satisfaction and administrative headaches. And so this is something very easy to improve. And we feel in this case, the use of technology that integrates with your clearinghouse and payers to automate pre-authorization checks is really an intuitive way to help improve those statistics. And a good practice management system or EHR can streamline these processes as well and reduce manual errors and alert your team of potential issues before they arise. And that's on the pre-authorization side. I'm not going to go into the full details across the rest of the board on those benchmarks, but we see some similar trends with patient deposit collections, where in 2024, ASCs collected 51% of expected patient deposits at the time of service. This was actually a decrease from 55% of patient deposits at the time of service. And patient bad debt is a challenge in the ASC environment. And Bill, as you know, it can be confusing for patients who get a bill from the physician, from the ASC and the anesthesiologist. And that billing process and some of the lack of visibility into patient responsibility can ultimately impact patient deposit collections. And then there's some blocking and tackling aspects of revenue cycle management, a big piece of that being days to bill. And in 2024, ASCs took 4.4 days to bill following the procedure. This was an increase in amount of time versus the average of 3.6 days in 2023. I think some of that's a reflection of ASC's high level of growth and being busy, but the longer billing cycles obviously impact cash flows. And so being very maniacal about the billing process is really important for the financial health of the business. And then lastly, on the claim denial rate, I already mentioned that there was a positive improvement of 4% denials versus 8% in 2023. And this obviously is a big tailwind for the ASC clients, but really systematically breaking down the revenue cycle process, understanding how you perform versus some of these benchmarks, which is in the 150-page report. It's available for free on our website. I think it can help really give ASCs and listeners of this podcast an understanding of really how they're doing versus a broad audience in the ASC space.
I think you're exactly right. And the last few things you touched on, thinking like pre-authorization, there's some really low-hanging fruit for a lot of surgery centers to both improve their bottom lines in terms of their cash flow and also prevent some patient frustration in terms of having to delay care because of not paying attention to those pre-authorization requirements. So as I said, I think anyone would benefit from reading this report. There's so much more insightful information in the report than we have time to talk about. So again, like you just did, I encourage our listeners to download a copy for themselves from the HST Pathways website. Any final thoughts you'd like to share before we wrap this up?
Briefly, I want to share an observation more broadly, now participating in the ASC space for a period of time and also having access to some of the data that we shared today. And Bill, that's that. I think 5 to 10 years ago, it was much easier to profitably operate an ASC But with the really impressive growth of the ASC market and increasing competition and consolidation within the ASC space, we're seeing that the game is changing a bit, and the world is really turning into the world of haves and have-nots in terms of overall performance of ambulatory surgery centers. And something as simple as increasing utilization of OR time by 10 to 20%, we see can have between $500,000 and $2.25 million in annual net revenue impact, depending on specialty mix. And so really having a high level of focus on proactive operations is what's allowing the best ASCs to perform at the highest level. And broadly, what we're seeing is that the ASCs that are being surgical with OR utilization and case mix, and they're analyzing their case profitability alongside trying to automate manual processes, including revenue cycle management. It's those centers that also benchmark everything to understand where they sit vis-a-vis the market and their competition, and even within their own facilities. And then lastly, really forecasting the hiring needs and supply chain needs alongside optimizing the physician experience. It's these different components that are allowing some of the top decile ASCs to perform really at an elite level. And so part of the intention of releasing the State of the Industry report and sharing some of this rich data with the market is to help guide ASCs as well as our partners into some of these best practices. And so we are all lucky to participate in such a beneficial and rapidly growing market as the ASC space. And I think through focusing on some of these business operations and best practices, we can continue to see this higher level of performance and optimization of ASCs as more and more higher acuity procedures get approved into these facilities.
I couldn't agree more. One of the things that we always trumpet about the ASC model is its efficiency. And I think, as you've rightly pointed out, it is harder and harder to be efficient because of all the challenges and headwinds that have come up over the last 10, 15 years. And this report, I think, highlights just the many different ways and many different elements that you have to pay close attention to if we want to remain efficient and if we want to remain that one little rational place in healthcare that kind of works right, provides great care at a lower cost to the patients that need that care. So I want to thank you once again for producing this amazing report, and for your team, and for spending some time with me today, and for HST Pathways' continued support of ASCA and our members. And I look forward to seeing you and your colleagues at ASCA 2025 in Denver at the end of April.
Thank you, Bill, and appreciate the opportunity to be on the podcast today. And we equally thank you for all of the efforts and evangelism and support that ASCA provides to the ASC space.
Thank you, David.